William is an 8-month-old female, yes, female kitten, who was brought to the APL by a Good Samaritan. William was injured, and the kind person who brought her to us reported that she would cry in pain when trying to move. Our veterinary team got right to work with this sweet kitten. X-rays revealed that William had a fractured pelvis and a dislocated right rear leg at the knee. An exam also revealed she had ear mites. Luckily for William, our veterinary team determined that surgical intervention would not be necessary, but would need to be closely monitored at the APL.
We do an initial assessment when a cat arrives, and we knew that something was wrong orthopedically. The kitten wasn't able to use its back end. So we're able to go straight to our x-ray room, take x-rays, get pain medication on board, and those all happen so quickly after the kitten arrives. And then she was diagnosed with a broken pelvis, and she also had a dislocated hip. Very common hit by car injuries. It's probably the most fortunate injury you can have when being hit by a car. So you think of getting hit in the front, you have a lot of chest injury, but when the animal's hit in the back, we can usually deal with bones. So she was ready to fight, ready to heal.
William required strict cage rest if her injuries were going to heal properly, and she needed to have her bladder expressed manually twice a day. But William was a fighter. Soon she was urinating on her own, and she was able to be spayed. Now her journey of recovery could continue in the home of an APL foster volunteer who not only could give her lots of love and socialization, but could also continue to handle her medical needs. William spent a month with her foster family, first continuing her strict cage rest, but then slowly being allowed to move more and more. Luckily for this kitten, every day was better. She was brought back to the APL for another set of x-rays, which still showed fractures, but also showed that they were healing well. The type of fractures William had can take months to heal, but hers were showing great progress. Thanks to the dedicated care and supervision of her foster family, she was on the road to recovery without having to undergo a stressful and laborious surgery. After 50 days in the care of the APL, she was ready to find her new family. It only took a week on the adoption floor for William to catch the eye of her new family, and off she went to her new life as a healthy, happy kitten. Kevin Jonas, a 9-year-old Maltese mix, was desperately in need of care when he came to the Cleveland APL. Our Humane Society agents brought him to the shelter when his owners failed to provide adequate care for this little guy. Kevin was in such poor shape that the mats in his fur actually had cut off the blood supply to one of his legs. His coat was filthy, his skin was raw and irritated, and he had urine and fecal stains all over his body. Kevin needed immediate care, and lucky for him, he was in the right place. Our veterinary team took x-rays of his injured foot and confirmed that there was no break. He was put on pain medicine and antibiotics, while the team went to work saving his leg.
When he came to us, he was clipped down, all of that done, and it's not a simple grooming. If you've had your dog groomed, it's not that you just go to the groomer and the dog stands there and has it done. When an animal's at a point of a life-threatening or limb-threatening grooming need, we have to sedate the animal. So it's a surgical procedure, and they get clipped down, all of the fur is gone. But what he was left with was really bad wounds, and we thought he might lose his foot or his leg, and we were really fortunate to be able to turn to a light therapy that we use. So we were able to purchase a light unit that stimulates healing. So we were able to apply that to him and repeat it every 7 days. And the foot that was at risk of being lost was able to make a full recovery.
Once our veterinary team was sure the little guy would keep his leg, they then could begin addressing his other medical needs. You see, Kevin also had serious periodontal disease. He already was missing 24 teeth. And when he underwent a medically necessary dental cleaning at the APL, 14 more teeth had to be removed. He was also neutered. After 25 days in our care, Kevin Jonas was ready to find a family to love him. With all he had been through, Kevin was understandably nervous at first and slow to open up, but he had a sweet nature that we knew would only blossom with time. And we were right. As his body healed, his spirit did as well. And once he was available for adoption, he found his new family in just 24 hours. Finally, Kevin's suffering was over, and he had found the home and happiness he deserved. Love is a tiny kitten with a big APL story. Love was just 4 months old and weighed only 2.5 pounds when he was surrendered to the Cleveland APL as a stray. His condition was dire. Love was emaciated and had a severe upper respiratory infection.
While Love was with us, Love received a lot of different antibiotics based on, we would do cultures to determine what the best antibiotics were. But then also, Love had some special procedures. So what was done here was little stents were placed in each nostril and they were left in. And it was kind of just a last attempt to preserve his ability to breathe.
He also had scabbing on his face that, once removed, revealed dead tissue in his nasal passages. To be honest, our veterinary team did not think he had a good prognosis. But if little Love was going to fight, they were going to fight for him. Sweet little Love was a very sick kitten. He stayed in our ICU at the shelter for several days, so our veterinary team could monitor his condition, provide treatment, and make sure he was eating and drinking on his own. Love was a fighter. He soon began to eat and drink on his own, and his wounds started to heal. He was well enough to continue his journey at the home of one of our foster care volunteers. Luckily for Love, his foster mom was experienced in caring for animals with medical issues. She cared for his wounds daily by applying medication and making sure they were healing. Love's other assignment, in addition to healing, was to gain weight and thrive under the loving care of his foster mom and begin to enjoy life as a 4-month-old kitten. Love's injuries took time to heal, and he was with his foster mom for nearly 3 months. As his body healed, so did his spirit. He also charmed his foster mom and provided her with input about what his future should look like. I'm sure you know where this is going. After 96 days in our care, 82 of those with his foster mom, he knew he had found the perfect home. His foster mom felt the same way, and as soon as Love was cleared medically, she adopted him. Love not only received loving care, but he found love at the Cleveland APL.
The Second Chance program is certainly the medical care that our team provides, but it is also the story of the animal before it reaches our medical department. When you see the animals when they come to us and how little they have had through love, care, they are literally broken, sometimes near death. And our medical team is able to take that animal and provide it with extraordinary medical care, but the love that that animal has not had up until that point. Our entire team does that. Our Humane Investigations team, our Animal Resource Center, everybody who's a part of our animal care team. And with your donations, we will be able to continue to provide the extraordinary care that our team does for the animals that come to us every day. They make the shelter experience, unfortunately, maybe the best experience that an animal has had up until that point, right up until our adoptions team finds them a wonderful, loving home.